The Momentum study is a phase 3 randomized study comparing Momelotinib to Danazol in the second setting after exposure of patients to Ruxolitinib. As we know, Ruxolitinib has been around for more than 10 years. It's a standard JAK inhibitor. It inhibits JAK1 and JAK2 that we use in patients that need to have control of the general systemic symptoms and the symptomatic splenomegaly. But it does not work forever. Average duration of the therapy in clinical studies is about 3 years. And the main reason for failing, it is lowering of the blood cell count, particularly anemia. And so what do we do then? In that setting, we don't have too many choices. There are other JAK inhibitors, but there is a need for new drugs. And Momelotinib, through inhibition of ACVR1 on top of JAK1 and JAK2, provides that anemia benefit, as we now know from the Momentum study. In 6 months comparison that was presented earlier on this year versus Danazol, it was significantly better for control of the spleen and symptoms, and also was beneficial for having a patient transfusion independent after 6 months of therapy. That's the key anemia benefit that we usually talk about, how many patients are transfusion independent. And so this information now on the initial results is extended at this American Society of Hematology presentation, saying that yes, this is valuable and it lasts longer. People don't lose that benefit. And there is a strong suggestion that transfusion independence actually make people live longer. And that this therapy is also valuable in people with low platelets as well, where we have struggled. We luckily have another drug approved in February this year called pacritinib for these patients. But the information overall on the Momelotinib is valuable because we are not precluded in any possible way in the future, if the drug gets approved, to prescribe the Momelotinib for any type of second-line patients. And that may even be the case for some patients in frontline setting to be given Momelotinib if they're particularly anemic. So in summary, we have evidence from a Momentum study that this is very valuable drug for anemia benefit, for symptomatic benefit, for the spleen benefit, with some signs of extension of life, and being valuable for any type of patients, regardless of their blood cell count. So good news if that drug gets approved next summer.